start, doctors.
Good evening, everybody. Am I audible?
Yeah.
Bismillahirrahmanirrahim. Thank you one and all for joining. I am Dr. Shamsia, basically from Mysore, but living in the UAE and connecting from UAE. I am a dentist and a network marketing professional. I have done my graduation from JSS Dental College, Mysore, and did my master's in conservative dentistry and endodontics from Stavropol State Medical Academy, Russia. Now, I have been part of Global Dental Professionals, the GDP group, for quite some time. This group was started in the month of November in 2017. It's a perfect platform for knowledge, a perfect platform for learning while sharing our experiences. It's an open forum for discussions. The goal of GDP is to register as NPO, conduct periodic health awareness camps, have online classes and webinars. Thank you, GDP, for giving me an opportunity to be a part of this webinar series. A few housekeeping rules for all the participants. I urge you all to open your webcams so that we can have a one-on-one feel. Can I request all of you to open your webcams? And please keep yourself on mute. Anytime the speaker asks you to ask some questions or wants to interact, you can unmute yourself. While keeping your webcams on, just refrain from having any unnecessary movements so that it doesn't disturb the speaker and the fellow participants. If you have any questions in your chat, you can please put it in the chat box. Most importantly, please sit with an open mind so that you can get all that is being shared. They say human mind is like a parachute, and you know, parachute works only when it is open. Well, thank you, GDP, again for giving me this opportunity to be part of the webinar series. When I was asked by one of the GDP core members, Dr. Shamsia, to be part of this webinar topic of today, I was just wondering, what do I talk? Me as a dentist, is it really relevant to me? But as I started reading and getting into the depth, I realized there was so much to know about this topic, so much to learn, and there was a lot of awareness, and I became aware of a lot of things, and it became really interesting. I do agree. This is a bit of a debatable topic for most of us here, especially menstruation and menstrual practices, which are still bounded by socio-cultural restrictions and taboos, resulting in adolescent girls to remain ignorant of the scientific facts and hygienic practices during menstruation. Hats off to all the mothers and the caregivers of differently abled children who have been coping up with them. Having said this, these kids should be given same right as the other individuals. Now let me start sharing my screen. Just check. Is my screen seen? Are you able to see my PPT?
Yes. Yeah.
Okay. American Academy of Pediatric Dentistry defines special health care needs as any physical, developmental, mental, sensory, behavior, cognitive, or emotional impairment or limiting conditions that require medical management healthcare intervention, and specialized services and programs. Now, children of special needs come with a spectrum of problems. They can include kids suffering from genetic disorders or biological abnormalities, such as Down syndrome, autism spectrum disorders, metabolic disorders, cerebral palsies, ectopic dysplasias, muscular dystrophies, cleft lip, cleft palate, or even non-genetic disorders such as complications during pregnancy and delivery, encephalitis, meningitis, or even it could be hearing impairment, visual impairments, not necessarily a wheel-bound child, which is normally the perception of most of us. Now, special care dentistry is the delivery of dental care tailored to the individual needs of the patients who have disabling medical conditions beyond routine conditions or medical or psychological limitations that require considerations beyond routine approaches. Approximately 12% of the population is considered to have severe disabilities. Now, caring of children with special needs require a lot of compassion and understanding. It requires specialized knowledge, which can be acquired by additional trainings, as well as increased awareness and attention, adaptation and accommodative measures beyond what's considered routine. Now, let me bring my focus to female child. The journey of a female kid to adolescent girl to a woman undergoes a lot of hormonal changes. Hormonal fluctuation that happens during puberty, menstruation, pregnancy, or menopause has a strong influence on oral cavity. Now, during puberty, there is an increased production of estrogen and progesterone. This will also increase the blood supply to the gums, which can cause swelling and bleeding during brushing and flossing. When a woman becomes pregnant, the level of progesterones shoot up. This increase causes more susceptibility to developing bacterial plaque that can attack the gums. Some of the other symptoms are the gums become very swollen, they become very tender, they bleed, and then the gingival recession and bad odor or the halitosis. During menopause, once the lady gets into menopause, it causes a lot of dry mouth, xerostomia, okay, which in turn is a risk for the gum disease and cavities, okay. When salivary glands fail to produce enough saliva to wash away the oral bacteria, germs can accumulate inside the mouth, raising the risk of gingivitis and tooth decay. Now, what are the effects of menstrual syndrome? Now, gingival tissue has a lot of estrogen receptors. Its response to hormonal changes are very rapid, which results in, again, dental problems such as the mouth ulcers, aphthous ulcers, gingivitis, dry mouth, again leading to halitosis. Then there will be delayed healing due to collagen loss, oral herpes, etc. Now, women are actually more at risk to developing osteoporosis than men. Because of the hormonal changes that happen during menopause, it directly affects the bone density. Now, estrogen is very essential for healthy bones. After menopause, estrogen levels falls, which can lead to bone density. Now, reduction in the bone density, it directly affects the jaws too, okay? And then the tooth supporting the alveolar bone, or the tooth supporting the bone which supports the tooth, okay, that starts becoming weak there will be loss, there will be mobility of the teeth, there'll be periodontitis, and there'll be loss of teeth. Actually, women are 3 times more likely to experience tooth loss during osteoporosis. Now, it is very sad that some of the parents and caregivers of specially able children are opting for non-therapeutic hysterectomy or forced sterilization, unable to bear the stress of maintaining the menstrual hygiene of the child or the reproductive issues what a child can face, and also to prevent their daughters to be a target of sexual abuse, violence, unwanted pregnancies, and abortions. Now, what are the changes what you see after hysterectomy? Again, dry mouth, loss of elasticity in soft tissues, including the gums, the bacterial buildup. Then during the menopause, again, loss of bone, tooth loss, and gum getting loosened. There'll be pathological migration, and finally the tooth loss. Now, few things, what little bit we can do to maintain the oral health of the children of special needs. Regular visits to the dentist is very important. Introducing brushing and flossing as soon as the baby teeth appear. And you can experiment with different kinds of toothbrushes, whatever suits the child. What I mean to say is with some handles which can be easily gripped by the children of special needs. Okay, and then the caregivers need to practice examination and use common terms before taking the child to the dentist. That can reduce the level of apprehension of the child. And also you can use the alternative oral products like mouth rinses or the xylitol wipes. And you have to make brushing and flossing fun for the children by playing music, interactive videos, and all that. Now, it is very important to have pre-treatment planning and proper assessment, including the scheduling of the appointments. Patient and the caregivers should be educated about nutrition and preventive oral care so that at least optimal minimal care, oral health care can be achieved. Now, most of the dentists feel that the oral cavity is our domain. We forget, most of us, our concentration is so much towards that tooth, we forget that we are treating a human. But by and large, the people consider us as doctors, just not dentists. Now, imagine a parent of a specially able child comes to you and asks questions pertaining to her health. What do we do? And what if we are posted in the rural areas? We cannot say that we are not responsible for these children. It becomes our social and moral responsibility to be knowledgeable about these kids and be aware of all these things, and at least to whom we can at least help them to direct them to the right person, guide them to the right person. It is extremely important for dental professionals to embrace an interdisciplinary and interprofessional approach to provide a proper care for these children. Now, oral cavity is the reflector of human body and its diseases. It's very important for the dentists to be knowledgeable about the patient's history, the medications they are taking, and also about the treatment, the medical treatment they are going through. Now, how many of us as dentists take a detailed history? Now, for example, if we see certain periodontal changes, does our thought go towards hormonal imbalances. Now, if we see bony changes in an oral cavity, do we really think of osteoporosis? Or if we see an adolescent child with a lot of other oral changes, does our thought even go, or do we even ask, has this child undergone hysterectomy? Are we aware of all these things? I don't think so. Most of us, our domain we think is our oral cavity. It's high time we dentists became aware of all these things. It is our responsibility. Now, actually speaking, the world is coming forward. Non-healthcare professionals are taking initiatives and taking it as a social responsibility. Millions of women are making their voices heard in the streets, on the social media, in the halls of government. And 2017 was considered as the year of period. Pop stars, I've just put a few examples here. Pop stars, sports people, lawmakers, and powerful activists took over the period stigma in an effort to normalize the menstruation and empower women around the world. For example, if you see the Indian company Zomato gives 10 days off for the ladies who are menstruating. Now, what are we waiting for? It's high time. We consider this as a social responsibility and take over. Now, getting closer to, let's talk much more about menstruation and disability. Now, my co-speaker will give you more insight on this particular topic. Now, this young lady is a passionate speech language pathologist who has completed her post-graduation in speech language pathology from All India Institute of Speech and Hearing, Mysore. She is differently driven because being in a position to help and create a positive impact in someone's life elates her beyond measure. Being an extrovert and a lover of all things communication and inclusions, she brings about awareness and acceptance about different communication disorders. Her main areas of interest include assessing, diagnosing, and treatment of various pediatric communication disorders, including speech and language delays, autism, dyslexia, cleft lip, and cleft palate, among the others. She has worked extensively with children and adults with different communication impairments and caters to their communication needs. She has a work experience in different setups compassing of hospitals, clinics, and special schools. Without further ado, I would like to invite Ms. Zainab Ismail to take over the floor.
Thank you so much, Dr. Shamsia, for that lovely introduction. I'm super glad to be here. I hope I'm audible and visible to everybody here today who has joined us on a Sunday evening. Yes, here in India, it's a weekend. I know for most of you all who are not in India, might be working, especially in the Gulf. So, but thank you for joining in today, and I'm going to keep it as interesting as I can. So stay with me, and if I'll get bored, you can just hit me up on the chat box and we can get this more interesting. Let's have a free flow of conversation here because we're talking something which has always been hushed about and, behind the doors. I think now it's time to take it all out and talk about it in the open because there are people suffering and a lot of them need our help and assistance, and it just begins with this webinar right here that we awaken and start off. I would want to share my screen. Yeah, that would be fine. Yeah. Kindly tell me if you all are able to see this. Before I begin, thank you, GDP, for this opportunity to be here, and Dr. Kausia and Dr. Shamsia for this wonderful, organization with everybody else of the GDP team. Let's begin. You all can be as talkative as you all want. Just put it in the chat box, please. Let's be interactive as possible. I do not want to be talking to the screen only. So I hope your videos are on and you all are into this with me. So the topic I'm here to talk about today is role of healthcare professionals in educating children with special needs and their parents regarding menstrual health. So two very tabooed topics, someone with a different ability and somebody who is a pre-pubertal girl who's just going to enter her puberty and start her menses, her menstrual cycle. Both of which in most of India are very, hushed about, but let's try and to understand what this combination is and how difficult it gets for somebody who has a different ability. Okay, so yes, already introduced by Dr. Shamsia in the most polite and lovely way. Again, this is me, and I'm a SLP based out of Bangalore. I found my niche as the SLP in the city on Instagram. I love communication. You can see how much I would like to talk to you as it goes on. And let's just dive in. Before we begin, let's define and clarify about what disability is. There are so many notions, so many old terminologies that people use. Layman terms being mad, mental, dumb, mentally retarded. In Kannada, we say ucha, we say, all the local slang and all of that. But what the actual definition is disability, according to the Rights of Person with Disability Act of 2016 here in India, a person with long-term physical, mental, intellectual, or sensory impairment, which in interaction with barriers, hinders full and effective participation in society equally with others, right? So now let's define the second terminology. What is menstrual health? So unlikely to the typical physical or physiological well-being, menstrual health also encompasses a state of complete physical, mental, and social well-being. It's just not merely the absence of a disease or infirmity in relation to the menstrual cycle. Let's look at the whooping number of prevalence of disability in India. According to the 2011 census, 2.2% of the Indian population. It looks a small margin, but the Indian population is pretty huge. So even 2.2% equates to around 26.8 million people living with disability in India. And the rate has been increasing rampantly. Look at the male to female ratio. We have around 1.5 crore male with disabilities in India, and female would be around 1.18 crores. And in this scenario, the literacy levels in this population of people is merely less than 58%. Okay. And this comes to the point of need. Why is Zainab here talking to us today on my weekend? So these are a few things that will awaken that need to actually sit and listen to us as we speak about it. Okay, so these are newspaper articles, clips from the journals and all of that, which kind of highlight why we're talking about this today. So first one says ignoring sexual abuse of disabled children shows India's lack of commitment. Women with disability faces higher risk of sexual violence and lower access to justice in India. Youth book for sexually assaulting 11-year-old disabled girl gets bail, and more like this, how people are actually fighting forced sterilization, meaning it's very rampant in the country. Some mothers actually opting for it voluntarily to prevent their daughters from sexual abuse, and daughters who have physically or mentally limiting disabilities. So according to this United Nations Population Fund, 80% of disabled Indian women are victims of violence. They are 4 times more likely to suffer from sexual violence compared to a non-disabled woman. And hysterectomies are often carried out on disabled girls, which are followed by requests from the parents and caregivers. Okay, so that's a huge number. That's almost 80% of the population of the disabled girls who have to undergo so much of trauma. Okay, So what is the right of such a person? So the RPWD Act 2016 stipulates the rights and entitlements of a person with disability. That's by the PWD. It emphasizes equality and non-discrimination, protection from cruelty, inhumane treatment, abuse, violence, and exploitation, the right to participate in the community life, protection and safety, as well as equal opportunities for education, skill development, employment, social security, health and rehabilitation and recreation. So I just had to throw some light on what the actual rights are and what kind of rights they have access to. Okay, but what is the reality at present? There are still existing prejudices and misconceptions about the reproductive anatomy and abilities of PWD, meaning they think of them out of as somebody out of the world. They forget that they are women at the end of the day. They share the same reproductive system as any typical woman would have. All right. They're considered asexual. There's some misconceptions about that as well. They're unsuitable for marriage, unable to manage their fertility or even raise children. Okay. And they have, limited access to sexual and reproductive health information and services, which is compromised because of these social and physical barriers. You will see me repeating this a lot because this is a point of emphasis. This is the main barrier that actually prevents them from getting help from healthcare workers and other social workers like us. Okay, so like I told you, what are the main barriers would be limited access to accurate, timely, age-appropriate information, meaning a lot of caregivers, parents, teachers in school don't inform regarding menses to the girl child very early on in life. They wait till the appropriate time, or even when she's already started her menstrual cycle or is on menses now. So it's become like a point of, like I told you, it's a very hidden topic. So until the child is at the point of getting her period, this isn't spoken about. So the child is not prepared at all. She suddenly starts bleeding and she's wondering what exactly is happening. Okay, and that is more limiting for somebody who has a disability, who was completely unaware what's happening with her body. Okay, so limited information regarding care for their bodies. At this point, there's no much information given about what are the available menstrual health menstrual care devices or materials that you could use, sanitary napkins, or it could be tampons or whatever it is. And what are the hygiene, water and sanitation facilities that every woman has right to during this period. Okay, there's a lack of positive experience and respectful environment. This is true because, like I told you, there's a huge stigma and taboo around it. There are still prevalent notions that, avoid men from openly talking about periods, prevent even highly educated people from coming out and telling things about menstrual cycle to their child. So there is that lack of positive experience that comes along the period cycle. Okay, there are some families that still believe in, not allowing the girl child to do whatever she wishes to do at the time of her period. So there's poor access to timely diagnosis again. So since there's so many limitations in understanding what the menstrual cycle is, if at all the child or the girl child develops some sort of medical condition post her menses, there's no access to that at that point in this late diagnosis. Okay, again, the social stigma and reduced knowledge about how to participate in all spheres of life. So there's a huge ratio of children who drop out, the girls who drop out after puberty, because they're not allowed to go to school during that period of their menstrual cycle. And you can see that major fallback or attrition in the girls that actually go to school before they turn 13, or the teenage girls, right? So this comes up to the important action area as to what exactly must be done. This is my proposal that says information, education, communication, and positive social norms related to menstrual health and hygiene for persons with disabilities. Now, this does not come from a perspective of a person from the SLP background or somebody who's a mental health professional or a doctor or a dentist or whatever health worker, anybody. This comes from purely being human. Okay, it doesn't come from being a woman. Actually, this comes from the fact that we're all human, and these are basic human rights that everyone should be given, irrespective of gender, caste, age, educational background, all of that. Okay. Now, why did I, want all of us to be listening? Do we think we play a role? I mean, it might be rare for you to see somebody with a special need, or somebody who is with a different ability walking into your clinic. But directly, you may not be involved. But however, if you realize that you are a stakeholder, because there are 3 levels of stakeholders, the first being the primary. Okay, I'm going to try to highlight this. Tell me if you can say that. Can you see the spotlight? Yeah. The first is the primary. So who come under the primary stakeholder? This is nothing but the person who has a disability, who is of reproductive age, the caregivers, the immediate family members, and the institutional caregivers. What are they supposed to do? They kind of provide education and impart skills to manage menstruation. Then comes secondary stakeholders. Now, these include special educators, ISL interpreters, and NGOs who particularly work with PWDs. They also impart information. Now, the tertiary level is where we come in. We are healthcare providers, the local governing body. So we are also directly involved in catering or creating a very conducive environment to change the existing norms and prejudices. Meaning, when somebody walks in to you with regard to any medical issue, maybe that would respect to their gums, or maybe any other physical abnormality, but if they happen to raise a query about their menstruation or the disability, I mean the problem that they are facing, we also are involved in getting them help. Okay, stop this. Okay, now, all right. So persons with disabilities have the right to comprehensive SRH. We've established that they have absolutely all the rights to have sexual and reproductive health information given to them, irrespective of what disability they present with. Okay. So why in India they still faces they face significant challenges to responsive and accessible SRH information, support, and services that goes beyond family, family members, which includes family planning, health services like maternal health services. And they are more vulnerable to SRH problems, which include their ability to negotiate safe sexual relationships, higher risk of physical and sexual abuse up to 3-fold. Okay. Now, the UNCRPD, or the Rights of Convention on the Rights of Persons with Disability, of the Article 9 of this CRPD, necessitates that appropriate, comprehensive, high-quality information in accessible formats should be made available to PWDs. I'm sure most of us are not aware of this, that there are clear rights of these people that we have to adhere to. Okay. Information and awareness of menstrual health and hygiene are essential to enable girls and women to manage menstruation healthily, with dignity and as independently as possible. So if you're somebody who has understood the process of menstruation, it's a big transition to make. So it requires you not to just have the mental ability to take care of it, but also have that physical preparedness, that environmental preparedness for you to just get on this journey and continue it. And imagine at this point itself, a child with disability, a girl who's just entering it, will have so many barriers, including her disability herself playing the major barrier, but also her community, her society, her lack of access to resources. So there are so many things here that actually render her helpless at this point. Okay, so let me tell you what are these barriers that render them helpless. Like I told you, stigma and misconceptions, this information being withheld by a range of stakeholders, which includes us, and lack of accessible information, and there's no proper training given to those who take care of the child with disability. Correct? Like I told you, the misconceptions are they're sexually inactive, they're asexual, so you need not include them while you're going on these outreach programs. They're unsuitable for marriage. They're unable to manage a fertility and raise children. So that's when the myth comes in, and they are not allowed, or there's limited access for them to use this information on menstrual health. Again, being literacy level is a major barrier. Less than 58% are literate. So whatever information is a text-based information will never reach them. And the reality being the information for MHH is text-based. There's very poor, visual representation. It's all text and words coming in, and they're hardly adapted to the need of the child or need of the girl and the marginalized groups, right? So it's like me not understanding what it is. Though I'm highly literate, I need to completely put my focus on reading this text. Or it's like us having to read our textbooks in a different language and write an exam in a different language, which is not fair. Like, you're expected to perform, but however the information given to you is in the most inaccessible forms. Some people are visual learners. I would prefer more pictorial representations to understand the human anatomy better. What if it was just words? You had to learn about the entire oral cavity with just words and never seen a picture about it. You'll have to actually go through your imagination, or more something more internal. What is it? There was no CT scan, nothing. You have to imagine what the stomach looks like. So it's like that. You're making information so limited because we think we can understand, so it's fine, but that doesn't work for everybody else, right? So exactly. So textbooks are, just 1 second, need to move this. Yeah. Okay. So textbook in regular schools mainly cater for those who are not impaired, okay, who are typical children, and I think the education societies find it very, very taxing to kind of translate the entire thing into more accessible formats. All right. And again, they're in the form of for example, there might be visual posters, but they're not in braille. For somebody who has a visual impairment or a disability, unfortunately will never know what's happening in that. There's no large print or audio experiential formats that are available. And coming to somebody with a sign language, what if the spoken content has never been signed out, so there's no visual representation coming in for them to understand exactly what is happening, right? If I at any point, if you think I'm fast, please feel free to stop me and tell me if you want me to repeat something. Okay. All right. Now, when I say information being withheld, I mean to say, like I told you, most of us are in the misconception that this part of society may not need this kind of information, but that's unfair because they also go through the menstrual cycle. They also have the same experience, or even worse, for all we know. So restricting that information is unfair, right? And lastly, this lack of information given to the caregivers, right, and the medical professionals to communicate with somebody who has a PWD. You can hear the common terminology of parents coming in feeling frustrated or overwhelmed, the mothers especially. They may find themselves being ill-equipped to be able to, guide their daughters through this phase of life. And if somebody, is in an institutional setup, has never built that rapport. So suppose person A is, hard of hearing and cannot speak or hear, while person B only can give information by speaking and does not know sign language, there remains a communication gap for life. There's no way either people will try to bridge. Of course, the person with disability will try, but if person B never tries to bridge the gap and come in terms of what's happening and trying to explain to them in the most suitable format, the gap remains and only widens with time. All right. So let's look at a strategy called capacity building. And here are the main stakeholders that need to be trained to deliver information to support MHH. So we can train the caregivers, and if the person itself comes in, if we are in a position, we should not step behind, since we are the key stakeholders at the tertiary level. We play an important role as well in in giving the information, correct? So now comes the big question, like, she's been telling us, give the information, but you all are wondering, what do we give? What do we say and how do we say it? At this point, I would want you all to unmute, tell me your experiences with somebody who has walked into your clinic. How equipped did you feel? Let's get to the reality of it all and share your experiences here before we move forward. So anybody from the audience would want to talk about it? No, I don't want it to be a very quiet audience, so anyone can say things, because I'm sure you're tired of hearing just my fundamental pitch on the wrong time. So come on, tell me. I'm sure you all have had some experience, and that's why you all are here to listen to more about it.
Now, when you say how equipped are we, I mean, are you asking in terms of the information available at hand to impart to the parents and the caregivers, or what exactly do you mean by how equipped are we?
Yeah. So at this point, there are two things I'm asking from the audience. First, I'm asking you all, do you have the information at hand, and do you have access to it? Before that, I'm asking you all to share with me a little about, did you feel the need to learn about this topic because somebody might have entered your clinic and you felt that communication gap? So any experience that you have felt before joining the session or in your clinical practice? That is my
this topic is very personal and then very relative. I mean, unless you have somebody who's disabled and your family or your relatives or your friends, I don't think so people genuinely take interest in getting themselves aware about how to pass on the knowledge or equip themselves in terms of informing the others or how to go about it. Unless, of course, somebody is really a part of your family or your friend circle or your circle of trust.
Right. That's when that's the main idea behind this. However, that's the reason I kept highlighting. No, you're a key stakeholder, irrespective of what connection you share with that person. If you are a healthcare worker, you tend to become a key stakeholder, irrespective of which field of practice you're in. So
when you're talking about the people with disabilities, how many people are really equipped in terms of handling such people in the first place?
Yeah, exactly.
Let alone passing on the awareness or the informing them about the menstrual health hygiene and the other general hygiene per se. But then, how equipped are we to handle such persons in the first place? I mean, how many people are even approachable in terms of okay, if there's a patient with disability coming to me or a person with disability coming to me, I'm willing to even provide the necessary healthcare, whatever, whether it is general healthcare or whether it is the oral healthcare. How many people are even willing to do it? I mean, I'm sure there are half or more than half of the people, more than half of the general healthcare professionals, they're just waiting for an opportunity to just push this patient to another person or refer this patient to the other people who are more than willing to or who are really into managing people with inclusive practices or the special healthcare practices.
Right. Very true, sir. Exactly what it is, the current scenario at this point. We're not saying it's right or wrong. We're just saying this is the reality of it all.
I mean, we should all get together and then have an inclusive mindset. We can't be like, no, I'm not going to treat this kind of a patient or this kind of a population. I'm not going to treat children. I'm not going to treat women. I'm not going to treat men. I mean, I'm sure. See, we come from a religion where there are some orthodox beliefs wherein women don't treat men. I know. I work in the Gulf and then I work in the Ministry of Health, and then I get to see a lot of people here who say, no, I don't want to be treated by a man. I don't want to be treated by a woman. I mean, I think it's time we get over this personal whatever attachments or I don't know if I can call it as an extremism.
Reservations, probably you can put it as reservations.
Maybe.
Because lack of knowledge is one thing. Hesitation to even talk. I think it all starts at home. Like Dr. Zainab was saying, it all starts at home. How a parent is equipping the child, and that goes on to reflect in our professionalism also. So I think that is why we are all here listening to her and trying to create awareness and maybe kind of settle down the hesitation at least. Maybe we're just baby stepping into removing the hesitations, probably, Zainab?
Yes, I think this is the first step to understand it's okay to have a broad mindset, because if you have opened the doors to help, the person coming in for help can be anybody. You cannot decide who you're going to help based on the capabilities or the abilities.
No, I would rather say it is not okay to have a broad mindset. I think it is imperative, and then it is right now, it is the need of the hour to be open-minded.
Right. And more inclusive, correct.
Again, the clinics in the UAE, the Ministry of Health have very stringent rules. Okay, we are supposed to make sure that the doors of our clinic are so big enough that the wheelchair can get inside. The washrooms in the clinic should be equipped such that a child with a special need or any disability will be able to go, like, having a extra bar and no steps in the
This is
clinic.
not just in the UAE. I think this is the I think it's part and parcels of the regulations and guidelines to.
But unfortunately, in India, we don't see even public transport,
Yes.
the basic public transport, at least in the area of the city which we practice, which is actually having PWD association itself. We see every second disabled or a differently abled child getting in and getting out. You have multiple centers on the same route, but unfortunately, we do not have the public transport accessing, be it auto rickshaw or public transport, bus stops. That's an unfortunate thing, and they are not affording. You do not have luxury to even take a private vehicle for these individuals. Forget about kids. We are not even going to the kids. We're not talking about kids, but even the individuals are not well equipped. The public transport is unaware. The people are insensitive to even assume that if somebody is taking a ticket to NIMHANS or Chandrasekhar Institute, the patient can be, hard of hearing. So the other person who's demanding a ticket or the fare or whatever is screaming to the core, and then it becomes a scene of, sad scene in the public transport of mockery. So such things we do witness, and that I think is
the fact is we are just not disabled friendly.
Exactly.
Those things actually kind of are quite hurtful to witness to the other people. I mean, of course, that's where we lack sensitization. I think creating a sensitized environment is where it begins, be it from children or adults. The highly educated, qualified professionals do not have sensitization when it comes to these kind of topics. I think that's very sad.
Actually, I have a cousin. Okay, she had a daughter who passed away now sometime this year. She was a differently abled child. She was there for about 40 years. And I used to see her, but I never gave until and unless Dr. Gausia put in a seed about this, what happens about the children of special needs. I myself, being a healthcare professional, never gave a thought. How is my cousin coping up with this, with her daughter? It never gave me a thought. Now I have become more aware. Yesterday I had a patient, okay, a lady patient with a very poor oral hygiene. Since I was preparing for this topic, like, I could get into a lot of questions what I had learned from here.
That's great. Thank you so much for sharing. And Dr. Gausia, I think that's exactly the point of, that kind of wakens us up, like what's actually happening around. When we are so, we have that very tunnel vision at this point. All of us are just focusing on what we wish to see and pretty ignorant of what's happening around us. The seeds of, inclusion begin at home, I would say. It really starts, I don't want to divert from the topic. I'm going to be very quick when I comment on this. It starts from home, on how we train our children. That actually guides our mindset. When we are able to widen that horizon of acceptance, we as humans have a very short definition of what is acceptable for us, and anybody who is a little different and goes beyond that bell curve is outside, excluded completely. We want everyone to be within that limit of acceptability, be it the society, be it your gender, or whatever it is. We have never taken anybody who does not fall into that two lines of acceptability as somebody who's also human. And I feel it's just that we individually should broaden our horizon, be more inclusive to differences. Some differences visible, like somebody who has a locomotor movement disability, or something which is hidden, maybe ADHD or something, someone who has a problem with mental health, depression. Some disabilities are actually hidden and may not be seen. Whatever it is, overt or occult, has to be accepted no matter what they are. And that is the starting point for us to do it from home and take it outward. If we are educated, we are gifting, we are self-gifting ourselves the gift of literacy, of understanding the world in a better way. And that is when we stand in a position to help somebody, being a healthcare provider, it's our duty to actually accept somebody who's different, and not just accept, but also help, because they are coming to us for a particular reason. And I think we all have taken professional oaths to help, no matter what it is. Helping is our first step, right? In whichever way possible. So that's exactly why I said has equipped our we, or like a reality check to what's happening. So at this point, let me help you give some information that what should be given and how you can give, because whoever's listening here is probably wondering, okay, now I know I have to give the information. What should I give information about? And if you want to give information, start about the menstrual, the female reproductive system and the menstrual cycle itself. Because first of all, they're medically oriented. We know it better to be in a much better situation to explain to them in a better way about what the menstrual cycle is, right? So educate them in the what happens during the cycle changes and what is expected out of them. Okay, you can educate regarding the menstrual products and the hygienic use on their maintenance, their disposal. You can also give information regarding the taboos and myths to caregivers and the PWD herself. You can talk about the PMS problems that she might face, what is that irritation she's facing, why she's been cranky just a few days before, her cycle, all the problems, cramps, and all of that can be openly discussed and spoken about to both the parent, the caregiver, and the child, right? What is the role of the caregiver at home and in institutions to support the menstrual health and hygiene practices, providing FAQs and booklets for persons with disability? Okay, some booklets look like these are just some pamphlets that you can find online as well. Okay, now that I've given you what has to be said, now how do you say it? No, there are certain limitations, right? So what would I give you? Clear, simple guidelines is always use clear and appropriate language with a lot of pictorial representation. Okay, given the information according to the disability, like if there's, I'll talk about that further. Information to be repeated and reinforced. Provide demonstration and hands-on training. Okay, so let's come to the last segment. I hope you're all in with the same enthusiasm we started with before. Okay, so communication approaches for information on menstrual health and hygiene, a healthcare worker perspective. Okay, let's see what you can do. First of all, if you wish to develop, the information, let's see particular the disability that is in question. If it's a person with visual impairments, use material with braille if you have access to it, or large texts. Simply use audio formats. Give 3-dimensional model dolls. I'm sure in the clinic we have the oral care, oral structure cavity model, right? You have that to teach explain to or counsel to your client exactly what's happening. Similarly, the 3-dimensional models can be used to explain about menstrual health. Digital information that can be given in the PDF format, so text to speech. We're all in the digital era, very tech savvy, nation that we've become. So use the thing for even those with disabilities, the text to speech, or that this can be also used. There are some kits which are readily available in the market. I'm not saying you have to develop this and say it, but your awareness about this can somehow guide somebody, right? If you're well aware, you will be in that position to at least give them a moment of your time and explain to them some amount of things, and then further send them off to somebody who's well equipped, right? So there are kits which are available, okay, that allows them to understand more about. It's a tactile model. It has books, so everything that a child or a girl with disability needs at that point to understand is provided in that kit. So if somebody who has a hearing impairment, the Indian Sign Language can be used. You can use pictorial format, so they perceive information more in the auditory way. Okay, so I'm sorry, I'm not telling you exactly what the limitations are of these people because we have lack of time. However, I'm just telling you generally what would help them. Okay, so somebody who has a hearing impairment will mostly rely on strategies like lip reading or visual inputs. If they're using hearing aids or cochlear implants and they're getting verbal, then it's good enough. You can talk to them clearly. If at all they're using sign language, you can give the information in sign language. You need not learn it. I'll give you some resources that you can keep, that you can also forward to them. Okay. And again, you can give running tests, text to subtitles, like closed captions can be used to explain to them what it is. So I'll just show you a simple sign of what menstruation is in Indian Sign Language. It's simply M on the hand and a C. Okay, M and C. That's the sign for menstruation, menses, menstrual cycle, or periods. Or visual books like a comic strip like this, because they can actually read and they can understand better. Okay. So if you have somebody who comes in with a intellectual disability, we no longer term them as mentally retarded or mad. We say the word intellectual disability. They work best with tactile and experiential form of language. This is the Bishesta campaign, which allows them to give a doll called Bishesta, and with the doll, they have taught the child about period, about the about changing the cycle, experiencing how it's supposed to be, and with this kind of an input. Okay. Low tech, which I use mostly in my setup, is flashcards for periods, changing the period step by step, giving them information irrespective of what it is. Pictures are good enough to understand, right? It's a much better way of learning. Okay. High-tech visuals are actually apps that you can use. These are freely downloadable on your tablets and your smartphones, and you can use these apps to tell them what you're trying to explain to them, right? So additional resources that I would provide is something called Red Talk. I found this on Google Play for Android systems, where you can download this app. It has both visual and auditory information about the menstrual cycle and hygiene of the menstruation period. And that's when you can also recommend this or try this out for children, or if caregivers come in with a question. Another resource for y'all is this website. Okay, I've put the links up for y'all. It's called Uninhibited. And the programs here allow you to, there's something called sustaining change. So the Arogya Sati is a helpline for, calling up, helpline for sexual and reproductive health. It's a free helpline, which most of us don't know about, and such help actually exists. So the only role we have right now is guide them to the right place. If we are aware, this shift can be made easily. This, redirection can be made easily. Instead of them always staying in that, blind spot of what's happening, we can be that guiding source of this is what you can do next. And that's about it. That's all I'm asking from you all at this initial point of time. Okay. And if you're interested, there's an ISL video, a link I've put up over here, which talks about, some menstrual signs and all that, which you can, if you're interested to learn, you can learn about it from this video. And lastly, just remember, we're in this together. We're a team. We're called interdisciplinary, team members for a reason. It's just that we fail to understand that we're all in the same platform. Okay, irrespective of what and where we come from, we have a common goal to help and to be in our best position to aid somebody who has a limiting problem. And you're not alone. Anytime you feel that there's something which you're not able to give enough information, always feel free to redirect to a speech therapist or a speech pathologist or social workers, or a colleague of yours who's also a little aware of the topic. So help is always available. You just have to reach out and be that guiding source. Okay. So with this, I open the forum. So let's talk. I know the hungry bells are ringing. It's almost 9 dinner time here. Let's be quick enough and see if this helps. And if this was an interactive session, and what should be our take home message from here. So the forum's open. I'm going to stop sharing, and you all can just see me and Dr. Shamsia and everybody else can start talking about it. Please unmute. I want to see everybody. I want to know who I've been talking to. So yeah, only 2 of us. This is me and Shamsia ma'am on the screen now. Yeah, much better. Everybody else can please unmute and put on your videos so I can see exactly the kind of people I've been talking to.
There is a question in the chat box from Dr. Ramesh. He asks, how will sterilization prevent abuse? It will hide the abuse. Right.
Exactly. So this is why there are 2 reasons why this topic was important, because we came across a flyer that says sterilizations are rampantly happening in this part of Madhya Pradesh, wherein a lot of girls, even before they're aware of their own bodies, the parents are getting them sterilized because they're scared that they will be sexually abused. They will be, they might be subject to violence, and there'll be unexpected pregnancies that come up. And that's when they enter forced sterilization. And it's kind of something they've been fighting about. Now is when it's come to the limelight, and a lot of social activists are, and female activists are wanting to stop this forced sterilization, because like you rightly pointed out, it's going to be a hiding thing. Yeah, that's right, sir. I think we can take a next question.
There's a second question by Dr. Arshia. She asks, kindly share few centers or clinics who are equipped to reach out to these kids in a better manner for further assistance.
Yes. So now this becomes a question of, geographical location as to where you are and what you're doing. That's why I put up the helpline number and the application, because that is more accessible. Via the helpline of the Uninhibited website, you all can direct the person based on where they are. So I would suggest you to, I will copy paste the link in the chat box for your convenience. That way you all can easily remember. Yeah. So if you're in Bangalore, I would suggest you can take them to Spastic Society of Karnataka and Indiranagar. They have a social worker team in place, which can help, and special educators right there. Okay, that is the link to the website which I've been talking about. And Red Talk is the name of the app, which can help you understand about menstrual health and hygiene. Yeah. Any other questions?
Everything said and done, I think I still feel that there needs to be done something about the ice breaking. I mean, people are not really open about discussing such an issues. Is there a way to break the ice? I mean, in the session itself, there are more than around 15 women, and then there are hardly any women speaking.
And that's the reason I've been pushing. Like, come on, let's just talk about it. We're all the same.
I mean, is it to do with the comfort level or what? This is a very important health issues and then social cause.
Yeah.
I mean, if you're not open enough, and then if you're not aware enough, and how exactly are you going to deal with it?
And everything again starts with I.
It's yeah, exactly.
All steps. Yeah.
I know we're not doing any harm in talking openly about it. I feel it's, if you're helping somebody out by learning something about, which is something which has always been hidden, I don't think we're doing anything wrong at this point. So it's okay to share your experience, and at least tell me at what point was that awakening for you all in the session. I want to know if it did help or did not help. Yeah.
Yes, Assalamu alaikum, Dr. Shamsia and Dr. Zainab. Alhamdulillah, it was a really wonderful session. Of course, I think everybody is aware that even a special need child will have the same kind of a menstruation like the other, other normal people have. So there's not much of difference. So probably people should be just equipped with the same regular symptoms what we face, like the cramps and what medications they can take to relieve, or maybe the hot packs they probably can maybe help. My question is, like, how do you approach this topic unless the parent comes, or we have a look in the oral cavity and we do see the signs what Dr. Shamsia mentioned, or we can see outright that the patient looks very anemic, and we do just casually question, is the menstruation okay? As a doctor you can, I think, and they do answer you. Okay, apart from that, I think getting into too much of details unless the parent, the disabled, ask you, I don't know how further can we help. Just these basic talks, and it's, I think, the other healthcare workers, the primary centers where they are going, probably they can help them more, how to wear your pads, how to dispose them, how to wash your hands, and be hygiene. And probably these are the general talks, probably how you can explain. Now, for example, if first of all, my clinic should be equipped that I'm able to get these kind of specially need children to my clinic. If there is a blind or a some disabled child and I have a steps on my clinic, of course you're going to search a clinic where these kind of accessibility are there. First of all, when you say how equipped you are, more than the knowledge, my clinic should be more accessible to these people. It should be on a ground floor, or there should be a ramp, and not everybody can't afford this unless it's like a corporate sector or a corporate clinic where people have these accessibilities. And individual clinic, it is difficult. Yeah, with the knowledge, I can be equipped, and I can definitely direct them to these centers where, yes, you can go to such a center. It's more accessible. You can go there. Or probably you can take a voluntary and go and work in those clinics, maybe on a weekend or whatever. And that's how I can see I can help.
Right.
I think asking about how to initiate the talk to the parents, first place is the patient most often comes to a dentist with a tooth pain. And we just address the tooth pain, and then we cater to the needs of, if the child is physically helped, we definitely want to know, at least I would want to know, if the child is addressed with the mental issue, because most of the parents are not revealing to you that the child is special in first place, unless the healthcare professional is aware of it, especially the intellectual disability. 99.9%, even the elite community, to the underdriven, underprivileged parents, they hide it from you. So it's your, it's kind of, at least I take it as an onus to kind of dig out the question and see, why is the child behaving in a certain way? So I start putting a prodding question, and then I realize that the child is going to a, regular school, but not being scholastically performing well, which is again an inhuman thing, because a child needs a particular therapy. So then from there, the thing starts, you start educating the parent and telling them this is not a stigma in first place. You need to come in terms and make peace that your child is not a regular child or a typical child. You need to give him a proper environment, that is National Institute of Open Schooling or the particular therapy. You need to particularly direct the child for the holistic or the well-being of the child in first place. So you start there, and then when you see an adolescent or a girl child, you also trigger questions. Have you addressed on the, when you see a poor oral cavity hygiene maintained, you definitely would want to see their clothing, you would want to see their personal hygiene. At least I do that. And I would check, who's giving bath, who's brushing the teeth, which of the parent is addressing to these daily activities of the child, or the self-care. Is the child taking it on its own? Most of the children do not brush before 5th year of life. They don't even, the parents don't even want to brush the child before 5 years of life, for whatever reason, because the child is not socializing or not going to school. So those kind of hindrances we see, and of course we'll have to start questioning, because you see aggressive severe ECCs or early childhood caries from then on. And that's how the hygiene starts, from oral cavity, and then you overall take an onus yourself. I mean, it's a very kind of voluntarily action which you start. And talking about the accessibility, we are talking about the clinic, which is very far. We're still, too far to provide the healthcare systems with that. Like I've mentioned a few minutes before, our roads, our public transport. So that is where we as healthcare providers forget about affordability. We are talking or trying to, form a group, or kind of, start questioning our government or the authorities to cater to the needs of the individuals, consider them humans in first place, rather than, segregating and creating a friendly environment in transports. And then it starts to the hospitals, and then to the private clinics, which is much later. Private clinics, privatization is much later. That is an individual, individual interest. But then we are, I think, community based. We are talking, or I think get together is basically on the community, hitting it on the community based awareness, basically, is what I understood from the talk. I think anything to add on, Zainab?
Yeah, that's exactly what what I was hinting at. It's a very personal interest that you've taken. I understand, what Ms. Arshia had to point out, saying like, there is certain barriers, but also when Dr. Gosha says these barriers are, in the hierarchy, the main barrier being our, mindset. Okay, the main barrier is our mindset, that we think our role stops here, the buck stops here. I don't know what to do beyond this. So I would, if you want to ask from a communication therapist point of view, I would really recommend just keeping some flyers. The fact that you create an environment around you that will automatically make that patient comfortable to bring that topic up with you. All right. So if I were to run a center, okay, and if I wanted somebody to open talk about menstrual hygiene, I would maybe just end up having pamphlets at the information desk, which I have, which reflects about my interest. So you go to clinics, you have magazines to read, meaning that the person who runs the clinic has the interest of reading, right? Or has particular political interests, or some newspapers out there. So you keep sections to entertain, or to for the patients to waste their time. However, if you do have information desks or some FAQs, do include the FAQs on menstrual health and hygiene for women, and also for women with disability. Okay, so what your steps are will reflect about your mindset, and maybe that will give like a key indicator to the mother. Okay, maybe she's somebody who's more proactive in this topic, and I can talk about it to him or her. Maybe it's a male gentleman who's there. And then when you enter the clinic, I'm not sure, because I can't speak about the practice that you do, but I can surely say, as you talk and build rapport, which is a very important part of our healthcare field, we do build rapport, because without that we cannot treat, without talking to our patients. That is when you look out for sensitive information, you look out for key factors or indicators that maybe hints that that person needs help. And if you want to probe in, you're free to probe in. And if you feel the same comfort from their end, you must probe in. At least for the medical perspective, like Dr. Costa said, looking at the physical outlook of the person, if she's maintaining hygiene or not, that are the medical key factors that you can actually start off talking about with. And if you need further assistance, like I told you, these are the references that you can give them. But step in, like take that first step. Don't wait for them to approach or wait for that. Okay, I just focus on what's in front of me. It's okay for us to, ask a question beyond than what is more obvious. So I would suggest that. Exactly. Yeah. Do we have books? So there are so many prevalent FAQs and section, on the internet. If you want to, there is a lots of resources available. All you have to do is just, since we print out huge charts of, other developmental milestones or, oral health stuff. Similarly, you have menstrual health and hygiene, sections and books which you can actually access and put it up. And I told you ISL videos, there are visuals, there are pictures, there are magazines. So there's so much information waiting for us to take it up and give it out. So yeah. Shalaba came on the screen. Does she want to say something? Yeah.
Yeah, I wanted to ask you something. In your experience, like considering a teenager girl with autism or intellectual disability, like you said, while building the rapport, if you felt something like this, how do you go about it? Like, how do you go about with it, or like, how do you start with this? And what is your? Do you think that this should be a goal in our therapy situations as well, if it is required?
Yeah. So, so she's talking about a perspective of somebody who has come into my therapy center and is an adolescent child on the spectrum. Okay, so one thing I've noticed is a lot of personal experience. Out of the full month that I would treat her, in that sections, I would see a few days where she's in the best of her behaviors. Well, sometimes there were some particular days of the week where I could see that high levels of irritation. So as a sensitive person, we notice the change, right? Day to day cycles of why is it changing? And on repetition and asking and a little bit probing, I got to know when she's close to her cycle, there is an evident PMS that comes in. So it shows up even in my clinic, right? It's not that only for at home she'll have that kind of a bout of, the temper tantrum. What we might think is a temper tantrum, she's not in a mood, she has a meltdown. We forgot that it's actually biological. It's because of her hormonal levels also driving her to behave like this, which we also do, right? As typicals, we do have those bouts, right? So just because it's somebody autistic who's presenting it doesn't mean it does not require attention or does not require that point of sensitivity. All right. So the next thing comes, Shalaba, communication is for everyone, and the entire essence of being a human is to be able to express. If I'm happy, if I'm sad, if I'm upset, whatever it is, if I love things or I dislike things, the fact that it makes me human is that I can express it. I can say it in words. I can show it my body language. I can give gestures for it. And that is the main essence. And that's a right for everybody. Okay. Now, when it comes to communicating regarding, somebody who has a period cramp, you and I would just say, okay, I think it's because of the menstrual cycle coming up. But a child on the spectrum may not have that verbal ability to tell you exactly, I am having cramps. She might just be throwing a tantrum, crying all the way, or having a meltdown, correct? So that's one thing. When in that point, it's your role to bring in the pamphlets, use the right approach. So my goal, for example, would be person X will be able to explain about her current menstrual condition, maybe a cramp, maybe she wants to change her pad. So all these are communication communication goals, right, or needs. So changing of a pad, meaning she might need extra help while bathing. All that should come into your goals and a right approach to teach them. So know the child's learning pattern. Does she want to learn via pictures? Does she want to learn via clips, audio material? Does she want to learn via signs? And if somebody is autistic, you know, they learn through visuals. So include a lot of that also in your practice. And I've shared some low-tech, high-tech visuals as well, which can be used for teaching somebody with a disability. Yeah, I hope that was.
There are a couple of questions. Yeah.
Yeah, there's a couple of questions coming. I'm sorry. What is the question? I'm sorry, I could not read that.
According to Dr. Arshia, she says, I guess more than a book, a short information pamphlet is good idea to keep on your info shelf.
Correct.
And this is one more question. One second. What age is appropriate, according to you, to bring in the topic of menstrual cycle for the girls?
Okay, so there are reports of children, a girl child of even 8 years of age getting into a, having her period. So how early is too early? You never know, right? I would say it's when the child is actually able to understand the world better. There's a phase of curiosity. All of you have seen that in your children. If you have, daughters and sons, there's an age when they're asking so many questions. 5+, 4+, they're asking what, when, where, why, and you kind of driving you mad because they're so curious to know. And when you're teaching them about the world, about things around them, teach them about their internal body also, right? Teach them about what are the changes which will expect to happen within them over time. So you should know your child better. You should know exactly, when it is to introduce. I would not say wait till puberty hits. When the pre-pubertal age, maybe 10 years plus, 11 years plus, when they know even their school peers will start talking about it. Unfortunate to know, in my case, my parents educated me about my menstrual cycle way before it happened. And I was the giver of information to other children and my other girls in my classroom because they never heard about it. So you see, it becomes like a talk of school rather than something which happens at home. So you don't want them to be getting wrong information from people, There's so many taboos and myths, and the child will just get so scared. So it's better that you as a parent know that only a mother should be doing it. No, it's an equal role of parenthood. Both dads and mothers sits together and explains to them what are the changes which are going to happen and how and when to react to it and how to take care of this entire phase. Now, this is for somebody who's typical, somebody who has a disability. There are different approaches, but the information has to be given. So don't stop them from giving that information. Yeah.
Are there any programs taken in schools or parent meeting to bring in this topic before the start of period?
I think, like Dr. Gosser said, it's a very personal interest topic. People, if you feel that it has to happen, I think at local levels it happens. I haven't seen it happen rampantly, to be very honest. There are a lot of talks on mental health happening now post-COVID because of the rise of cases coming up. But about this, the scenario in India is still not very good when it comes, or when people are not accepting this is a very important subject to be spoken about. A lot of taboo about this and sexual health which comes in to play. So I think I'm proud to say that we have started that program with the global dental professionals. GDP has initiated such a program, and I think we should go widespread from healthcare professionals to more people out there.
There's one more. As we see, there is gender identification happens at 3 years. Is there any study about the understanding of periods or menstrual cycle in children?
Okay, at this point, I'm not too sure about how the study is prevalent, but I can get back to that. However, the gender identification happening at 3 years is correct. The child starts to identify and realize or affiliate to one particular gender, if not like I said. So there's no study that I have come across at this point. So yeah, I'm not too sure about this.
Sort of an introception. So especially with differently abled, when they're not able to identify their own hunger or the need to toilet, or the introspection kind of sensory issue, when they have the body awareness to be the umbrella term. So in such children, yes, of course, then the gender identification again is not certain at 3 years, I think. I mean,
yeah, it is right. Like she said, introception is missing in most of these children. So even if it's very difficult for us to define like what age will they be able to realize that. Correct.
We missed a question from Dr. Asia Nagar. She wants to ask, these days girls get their periods early. Do you think food plays an important role?
Cautious puberty. Yes, I think the adulterated food, the ingestion of hormones in the the adulteration which is happening in our food products is one of the definite cause for precocious puberty. And I think that's when the awareness, or the body awareness especially, be it the abuse or there is dignification of the body for both the genders, for that matter, boy and girl, should be initiated much early. So there's I mean, the parent is the best person to assess when is the age right appropriate, because the child is
I don't agree in terms of precocious puberty being considered a factor for a person being considered disabled.
no, I mean,
No, sir, I didn't get the question. I'm so sorry.
The question was actually these days the girls are getting their menses very early. Do you think, according to your opinion, what do you think that food plays an important role in this precocious puberty? I would like to share a personal experience. I had a class fellow of mine whose daughter attained precocious puberty at the age of 5.5 years. And this is really strange. I think this is a very alarming situation wherein you are seeing a puberty in terms of such early stages in early age. Is it attributed to the temperature or the demography or the food pattern? What exactly is it? I know it is multifactorial, I'm sure.
I guess it's multifactorial. And for me, in my perspective, like it is a very case-centric thing, okay? Because there are early chances of menstruation in such case. And then also there are so many new things that are coming up. There are high stress factors, food that plays a role. And I'm not sure if that child has any other medical condition that led to early periods. So I don't really know, because the case history is unknown to me at this point.
Sir, actually, when I was staying in KSA, I have noticed the girls, especially living in those regions, and the Arabs particularly, they do have a tendency to get their periods faster because of the food too. That's what it's been told, like the dates, the olives. These are some foods what they take, and they do swear by those foods that because of those they do get it fast. Okay. And but compared to the girls in India, and of course, as Dr. Shamsia said, the hormone injections and all these things are playing a big role, for the girls to get faster. And as Dr. Saida was asking, when is an appropriate age? As a mother of 4 girls, I can actually tell you, you are the right person. A mother is a right person to introduce the child to this topic at the right age. You're seeing your child every day, so you can make out the bodily changes in her. So when you start seeing the hair growing, a little bit of armpit hair growing, she's ready. It's going to be there. So probably that's when you casually take out the topic. And coming from an Islamic background, sometimes my children used to ask, Mommy, some days you don't pray your salah. Right. So I used to tell, yes, there are some, you're still small. You can, pray your salah, you can miss, but there will come an age where, you have to start praying regularly. Like Islamic point of view, I used to give these kids, and they have taken it so well. And they realized, when they hit the right age, they said, is this a time when I start praying regularly? I said, yes, this is the age. Now you have it now. And, invariably, they will get some information from school. They will get it either through friends or in Saudi, especially these girls had, classes where the school taught, but my kids took it in a wrong way. My kid was so petrified. She came back crying. She said that we all are hens because we lay eggs. This is what she came and she told me. She was scared. So I didn't know what to say. It was too scientific for them. Okay, so I had to put off the question and just explain it in a different manner. So a mother, for me, I think is the best teacher to teach a child in a better way, in a way your child understands.
I feel the sooner you introduce these aspects to your children, the better it is. I think the information has to be given, taken from the parent rather than from the outsiders.
Yes, sir, but see, like as you said, your friend's daughter had it a 5.5 years. So I'm not comfortable talking to a 5.5-year-old girl. Okay, yes, there are very few incidents where at 5.5 or 7 it's happening. But then again, you know when to introduce these topic to your child.
No, but then the thing is, see, the thing about precocious puberty is even the medical healthcare professionals, what they do is they start supplementing the child or the affected individual with hormones, and then they try to delay it to a more appropriate age. They just don't let it go, and then they just don't treat it as a normal. Precocious puberty is not treated as a normal issue.
Because the child is cognitively not ready to.
Prepared.
Absolutely, absolutely, yeah, absolutely. This is the reason why I think the healthcare professionals,
Ghazala has a question.
Supplementing the children with hormones to modulate the hormones in a way to delay the menses to an appropriate age.
Assalamu alaikum warahmatullahi wabarakatuh. I do not have a question, but I just wanted to share my viewpoint. I think Dr. Arshia was speaking. I totally agree with her that as a mother of 3 daughters, I feel that sensitizing the girls at home is very important. Firstly, when we are not praying, we inform them, yes, you will reach a stage. And secondly, I feel fathers need to know this. Fathers need to know when the child is having her periods. This thing that, you don't inform the guys, you don't inform the fathers, you don't inform any male person in the family, you do everything hidden. That should be taken out from the families first. And also I feel after this discussion, this is what has come to my mind, that we regularly put posters in the clinic. I think we should put some poster related to menstruation or doubts or queries regarding this, and then write a statement below, like if you have any queries, you can always come back and speak to us. So that will be an indirect message to many mothers or ladies who would want to come and talk to us.
Sorry. To add to this, I mean, it kind of develops a body shaming when you're refraining the men of the family unaware or hiding it. It becomes guilt to the person who's undergoing, the menstrual cycle, and it inevitably creates a body shaming atmosphere to the, individual who's going through it. So yes, that is psychologically, yeah. I mean,
especially in front of the father whom the child needs to bond with, and the brother who's supposed to be her caretaker. If you're trying to avoid these topics, this is going to create that, real low self-esteem in the child.
Yes.
So I think that 2 points I needed to highlight. And even in the clinics, just to start the conversation, even if you cannot ask, if you put in such posters and then write, if you have any queries, come back to us. I'm sorry about the...
No problem. Ghazala, you can continue.
We can always, encourage parents, encourage mothers. Probably they'll see those posters and then come and ask, doctor, I saw that poster, I wanted to talk to you. I think, this would be one nice suggestion which I could give.
I think especially in our country, the body shaming is more, and the stigmatization with the Indian culture in particular. When we are segregated, there is a place in Maharashtra, if I'm not wrong, wherein you have a small town where the ladies who are menstruating are supposed to go and stay in those particular huts. Yes. As if they're doing something, they're actually, it's a sinful process which is undergoing. It's considered as a sin. So I'm not sure of the place in Maharashtra, but that is a place wherein the ladies are given separate huts from so many kilometers of the actual state. So, and then people are refrained, the girls are refrained from entering the kitchen in particular culture of our country. So those kind of things are actually body shaming and psychologically affects the individual. And that puts the whole woman empowerment down, it just goes down.
And one more thing is many patients, they question me. Doctor, can I get a filling done during my periods? Doctor, can I get an extraction done during my periods?
I think extraction doubts are very common, especially any surgical procedures during menstrual cycle is, I think, quite common. Be aware, yeah. I think Dr. Nayyar was talking something and we had to take Ghazala in.
Are there any more questions? And I think she's very right when she says, that we have to desensitize this topic at home. And it's quite evident that we hide it from our male counterparts that when we are on menstruating, while we expect, protection and, all that, that care and bond, especially when we're menstruating, and we hide it from our male counterparts. And that's unfair. And like you said, it leads to low self-esteem, that entire psychology behind that getting a period becomes a big, point of, okay, it's a sin and I am considered filthy, I'm dirty, don't touch me. So imagine these negative terminologies on the mind of a very young girl and living with that for the rest of her life. And then, there's no awakening happening. So it's better we start early and we get this right on point. I really liked how this discussion went forward. I was pretty happy with people opening up, and I'm waiting for more people to, say it was much needed. So yeah.
At least 4 years back, I myself confess that, I was not aware of a special needs girl undergoing a menstrual cycle, to be frank. That was the thought. I was working extensively with special needs kids until one day when I came across a mother who was coming and telling me that she's, not handling the toileting of the child and would want to go for sterilization, is when I realized, okay, so these, I think that was a thought which was left much behind. Though we are all aware of the biological process, right, and we know it is a, special needs girl, but I forgot that the biological, she would be going through this. And that is when I thought, we should all know about it. And yeah, of course, the abuse and the hysterectomies, the sterilizations, I think that was something which I myself was caught unaware almost 4-5 years back. And I think that was, yeah.
Most importantly, I think the awareness of the menstrual hygiene and the menstrual cycle being a physiological aspect of the body rather than it being attributed as a medical condition or ailment. The differentiation is very important. I think you have to start building in, people, who are bringing in much awareness in terms of this being considered as a physiological entity.
Let's hope we start the initiatives. That's all we can say. Irrespective of the repercussions, or sometimes, yes, it's still stigmatized though. We have still a long way to go to kind of open the mindsets, actually. Yeah.
I think people are still hesitant to talk about it and then open about their experiences. This is, I think, we being as healthcare professionals, I think we should be more open about it.
But I'm glad we took the first step with this talk. So I'm sure there's something that, triggered a question in all of the participants that came here.
Well, I believe in not waiting for the change and then being the change.
Yeah. Being the change is, I mean, it's high time we are highly proactive now. There's no time for us to, wait for change to happen. That's right, sir. Rightly pointed out. Are there any further questions? Like, any comments that you want?
Dr. Nikhat says awareness is the start. Absolutely.
Sensitizing. Yeah. Nikhat, you want to speak to us? Dr. Nikhat is actively into social causes as well. Dr. Nikhat.
Hey, I'm really sorry. I had a function at home, so I joined late.
Yes.
So I was an active listener, and this part of the interactive session was really, really nice. I'll go back and watch the entire session. But I must say, Zainab, your smile is so enticing that it was really captivating the entire talk. Yeah, good to have you here.
I think we can conclude, Dr. Shamsia.
Yes, Dr. Shamsia. I'm sure after listening to all the discussion, it really has added a lot of value to every person who attended. And I'm sure, I think everything begins with I. So let us be the change. If we want to see the change, we have to be the change. Thank you very much, Zainab, for taking your time and being part of our webinar series. And thanks again, one and all the participants for making this successful.
Thank you so much for having me and for this wonderful opportunity. And I'm really hoping there's something we all took back home today with this webinar. And like she said, awareness is the start. So let's just do it.
Thank you, Dr. Zainab, and thank you, Dr. Shamsia.
Thank you.
Sorry, Ms. Zainab.
Thank you, sir. Yeah.
Have a good night.